Legacy Community Health is a federally qualified health center, what most people call a community clinic, and we're committed to providing preventive and general primary care services to our community, regardless of their ability to pay. This clinic has been around for more than 20 years, but about 3 years ago we joined Legacy, who has more than 30 years experience serving Southeast Texas. Legacy Community Health serves more than 125,000 patients every year. Here in Baytown, we serve just under 30,000 patients per year. Here in Baytown, we provide a full spectrum of services, from OB maternity care and gynecology to pediatrics, family medicine, geriatrics, and even behavioral health.
Integrated behavioral health models utilize a behavioral health clinician who is embedded in primary care practice areas. Having a behavioral health consultant as part of the primary care team makes patients realize that their mental health is part of their overall health. Patients are usually much more comfortable talking to someone who is part of the team that's taking care of them in their primary care office. We've seen for many years that if a patient is referred to an outside psychiatrist, they show up about half of the time. Integrated behavioral health models improve access for patients. There's a lot of difficulty accessing good behavioral health care. There's often long wait lists to see psychiatrists and therapists. So embedding a behavioral health consultant in the primary care clinic gives patients access often on the same day as their primary care appointment. What patients find is that they feel that it's a team that's taking care of them, not a bunch of individuals. We find that our patients and families really appreciate being able to take care of all of their healthcare needs in the same visit.
The Legacy San Jacinto Clinic is one of the 2 family medicine outpatient clinic sites for the Houston Methodist Family Medicine Residency. Family medicine is a unique specialty because one provider has the opportunity to care for the entire family, from the newborn baby to the children, adolescents, the pregnant mother, adults, and even geriatric patients. It gives us a unique insight into the family dynamic that allows us to provide the best care possible to the entire family. Residents come here to see patients every week for the entire 3 years that they're in residency training. Here in the Preceptor Room, residents have the opportunity to check out patients so that we can discuss cases and make sure that patients are receiving optimal care. At the clinic, we also have the opportunity for residents to learn various procedures. We have a procedure room designated with equipment which allows you to do a variety of things.
The program has allowed me to develop different skills in different areas. I feel very comfortable doing hospitalist type work. I feel very comfortable delivering babies, going into C-sections or any surgical procedures. I feel comfortable seeing newborns as well as geriatric patients. And now as a third-year resident, I feel that I can pursue any area of family medicine that I would like to go into.
Residents at this program will have didactics every Wednesday afternoon. The 4th Wednesday of every month, lectures will be here in Baytown in our state-of-the-art Legacy classroom. We have the opportunity to come together with the psychiatrist, psychologist, and our integrated behavioral health therapists for the Integrated Behavioral Health Conference, where we talk about cases and share educational points to improve our ability to care for patients with behavioral health needs.
So some medical schools and residency programs around the country are already incorporating integrated behavioral health models into their training. There's a realization that this is probably going to be a predominant model for future care as we move to more integrated care in all of medicine.
Like many of the residents, I live in Houston, and I have the opportunity to enjoy all that a major metropolitan city has to offer. Yet it's still just about a 30-minute drive from the San Jacinto Clinic location.